But it's great to see you, Bill, and where people are slowly coming on. I think after Thanksgiving, we had a little bit of a drop off, but this is, we're recording this obviously. So we're going to want people to get in and check it out. And, I added something. I did not do as good a PowerPoint as I normally do, but I added something on Bob Dole for us to say that as part of our, we have plenty to talk about, needless to say. Today's session really is focused on independent living activities and, just not only the history, Bill's history in terms of working for access and the promise of the ADA, but, just giving folks a broader sense, right, in terms of disability activities, policy, and action, and I remember you taking the bus a number of times from the Cape instead of driving, right, in the early days, and you don't have to do that. So, well, you can do that now even easier because you live in the Boston area and oversee BCIL. So
I live in Boston.
Right? Yeah, it's
Boston
pretty cool.
proper.
Right? Right, though you've got a little bit of a rural feel, right, to your neighborhood, don't you? Despite it being in Boston or suburban.
I grew up in right outside of Worcester. I went to school at UMass Amherst. I worked and lived on the Cape for 20 years. I've been in Boston about a few months short of 20 years. So I'm familiar with many parts of the state anyway.
Pretty cool. Good. So the big thing that happens with this slideshow is I often can't see anybody, but that's okay. I'm going to try to, actually, I'm going to make it. I think I just fixed that problem and we're going to start it. I'm really impressed with myself today, not messing that up. Let me share the screen with folks. Okay. You guys see it okay? I hope. The PowerPoint, it's big enough. All right. So our mission, enhance the lives of people with intellectual and developmental disabilities, including autism. And we fulfill this through advocacy of community supports and services, but we will also do it because we want to establish equity. Sorry about that. We want to foster equity and we want to foster social inclusion and self-determination. And that's something I know you feel strongly about. Bill's background, for those of you that weren't with us a few months ago, we talked about 1990s policy and it was like, we didn't revisit the past because the past sometimes is still in the present in many ways, as we discovered in a couple of situations. And especially with the post-COVID period, sometimes we fear, what could happen. Today, first, let me give you Bill's background. He's executive director at the Boston Center for Independent Living. He's a founding member of Healthcare for All, board member and planner for Common. And through that role, he was a planner for Common Health for persons with disabilities and Medicaid buy-in, and he's very active in health care advocacy. He just sent something out today about the meeting last week with Mass Health. And then, of course, the legal action for MBTA access, housing advocacy, and ongoing systems advocacy. So I wanted to start with that. But you want to say a few words first about Bob Dole? Because you've been around. You were,
But Bob Dole, I think that anyone wants to get a sense of Bob Dole, if you can read David Shribman's appreciation in today's Boston Globe, you'll get a sense of Bob Dole. But what a true giant. I remember thinking, in the 90s, he was a kind of ornery guy, but boy, was mild then compared to the political dialogue today. And he was, really injured in World War II in Italy towards the end of the war. Significant injuries, and rose to become, presidential candidate, leader of the Senate, never looked away from disability issues, and became very much a champion of disability rights in his latter years. Certainly a giant from maybe what we look at as a passing era, but there are key issues, supported the ADA, foundation, many things, a giant.
Well, I just want to say, you said supported the ADA, and I know we tend to you and I tend to focus on Tom Harkin and others with the ADA for a lot of reasons, good reasons. But Bob Dole was a key person in the passage of the ADA when bipartisanship meant something. And your reference to his I love that, because he was actually called, and I never really took this in till later, hatchet man for Nixon. And what's remarkable about that is who he became, and really just sort of dispelled all that. He claims that's because he lost a presidential election, that people feel sympathetic to a loser. But he was not great in social situations. What I didn't know at all until I read something about him in the Times was he didn't like going to dinners because of his limitations with his, eating at the table. So, and the newest thing I learned is he developed a device for him so he could become more mobile. And it was some kind of lever in his, in Kansas as he recuperated from those injuries that you described. So yeah, so pretty significant figure, and I'm glad that we're together today, Bill, to talk about him and comment on him. We can talk more about that later, but it was a different time that there was a lot of rancor because Newt Gingrich, right, got elected right around, as he was both majority leader and finance committee chair, Bob Dole, by the way. And we love that because he played a key role in Social Security, in the health programs like Medicaid, CMS, Center for Medicare and Medicaid. So he knew this stuff as well. And you mentioned the Dole Foundation as well. And as a Republican, he's one of the few that worked for passage of the United Nations Convention on the Rights of Persons with Disabilities. So, he, and I guess we had Jeffords and there's a lot of other Republicans, right, that worked for things. But Dole, I agree with your term, the giant. He would be a giant in this regard. So anyway, so we last time we met, we talked about all the things that still the work ahead. And I'm going to sort of get off the PowerPoint, but in terms of the realizing the ADA, and do you want to start with talking about independent living centers a little bit and BCIL? And because people may not know a ton, and then go from there to talking about some of the access advocacy you've been doing. And
sure, I can. And I welcome any questions in the chat or however you want to, send them to Leo today. Can send it to me. Independent living centers have been around since the early 1970s. There are probably about 700 in the United States. You have to meet a set of criteria to be designated by the federal government as an independent living center. We're private, nonprofit. We are not government entities, but we live by and large through state and federal support, supplanted by dues, donations, grants, working with foundations, et cetera, like many nonprofits. What we aim to do is provide individual services to people with disabilities and systemic advocacy. A hallmark is that we're cross disability. We serve any person with any disability of any age. We often get categorized as just for people with physical disabilities. That's so far in the rearview mirror, it's unbelievable to me. But when the centers were founded, they were founded by a lot of high functioning folks, so-called, whatever that means, in wheelchairs, and that categorization stuck in people's minds. Probably 40–50% of the consumers we see have a mental health disability. Many have a physical disability. I will say, frankly, we don't see as many folks with intellectual disabilities. There's a good reason for that. Lots of them receive great services through the various ARCs or big providers, say Bay Cove, VinFin, Seven Hills Foundation, but we work collaboratively. When we talked about it at the last meeting, Leo and I, went down memory lane and how we've been working together since really 1992, I think we decided upon, or 1991.
Yeah.
And these, ILCs are nothing if not collaborators when we're doing the job right, working with other programs. I think we've worked very well on major mass health issues, We definitely have worked on deinstitutionalization. It was on that drive that I met Leo when there was an effort to close the Dever School, some of the public health facilities, and the Fernald School. Institution, school is not a correct term because no one was learning a whole lot there. Trust me. My good friend Sybil, as I always say, went there 23 years and didn't learn much of anything. Should tell you that, even though it was labeled the school at development center, whatever. And one of the things we often work on is architectural access. I think it almost goes unstated with Leo, and we've got this kind of chemistry almost. BCIL handles, as do a lot of the independent living centers, some even way more than we do, Stavros Metro West Center out of Framingham, issues around the Architectural Access Board, physical compliance with the ADA on physical structures. We, though, for instance, sued the MBTA for ADA compliance with Greater Boston Legal Services. A settlement was reached in 2006. It's still in effect. It's produced about $1 billion is our best honest estimate. That's not inflated in access improvements. And we also work on PCA issues. You know, I think that's one of the issues along with the institutionalization I first worked with the ARC on. And it's not as involved because it's in pretty good hands where we're involved. And that's kind of this unstated collaboration almost, and we come together. But the disability arena, the agenda is huge. And, you know, you say people with disabilities, people with intellectual disabilities, mental health conditions, physical disabilities, blind folks, autistic people, deaf, hard of hearing, and we sometimes divide, and on our best days, we divide and conquer. Unified, we're not, and then we conquer, not as a divided entity, but as a unified entity. Sometimes we run head on into each other and there are disagreements, and I always like those times because we can pick up the phones and iron something out and get to a better result in the end. I think so. Independent living centers, even if lots of folks don't know them, actually have a significant role in the independence of people with intellectual disabilities.
I want to reinforce that, Bill. Let me jump in and just say, you know, Bill, see how much background he has, by the way, folks. You know, it's coming at us like he sounds almost like me going so much at a time because he's usually more moderate. Like you, Leo. I know, but you're usually more. But this is the thing. This is the depth, right, of your knowledge and breadth of your experience. I just want to say the transportation thing you mentioned, right? When you mentioned the amount of money, we owe a debt of gratitude on that whole settlement, really, that we haven't given enough credit to, okay? Because it's one thing to pass a law, right? It's another thing to actualize it on the ground. And that's really, and there's more to be done in transportation and access, obviously. But remember, a lot of what Bill has done and others in the movement, but especially with Bill's leadership, they've taken something that maybe the public as a large, as a group doesn't need, right? For example, the access stuff, right? In the train stations or the subways, but yet has been able to sell that and or legally argue for that in a successful way. Because again, public opinion why are you doing this? Bob Dole got a lot of that. You know, he was called a tax collector for the welfare state by Newt Gingrich. So it's sort of horrible, right? What people's lack of empathy is and understanding of people's rights. But anyway, I do want to say too, in terms of being able to work together, you know, the division really isn't usually a division. It's more like, okay, we're coming at it from different perspectives. And then what's great about that is we do talk it through. I just want to point out, you're part of a coalition that's going for housing, architectural access, right? Making the ADA alive in Massachusetts. And for some reason, we haven't been part of that coalition for a long time. How long do you think those bills have been in play, Bill? A few sessions? 4 sessions?
A few sessions, like 14 years, 16 years. I got reeled in about 2.5, 3 years ago. we've got a real good team looking at what the barriers are. I think, one of the hallmarks, I think, of your work, Leo, and folks who are on the call is it's very practical. I've always, and I said this when I was on a while ago, I've always been amazed how much legislatively gets done in the IDD community, and your master's at it, but you figure out the world of the doable. And I dare say on some of the access bills, we didn't figure out the art of the doable, which means figuring out what you can't do, not figuring out what the opposition was. Somebody said to me one day, but this is a good bill. I can't imagine it didn't pass. Well, this session, there'll be about 2,000 good bills that don't pass. There's
right.
art and science to it. It's both art and science. You guys have always done great on that. And I think we're looking at that as a way to expand housing. There's a lot of rehab of old factories, old churches. That stuff doesn't have to fully comply with the access rules, and we're losing unit after unit that could be accessible. And that's important for people who may age in place or want to move into an accessible unit. And when you're thinking of accessibility, we're not always just thinking of fully wheelchair accessible. We're thinking about vertical access, adaptable housing, things of that nature. And that's really important. And that's something the independent living centers have always worked on. And again, it benefits the broader community, benefits the IDD universe, because many folks have significant ambulatory disabilities. May not even be in a wheelchair, but may have arthritis, injuries, other COPD, asthma. There's lots of things that can impede mobility, even if someone appears ambulatory, let alone if they're in a wheelchair. Oftentimes, somebody in a wheelchair may have way more access to the community than somebody who doesn't.
Right. And we just, we just agreed to be part of that coalition, by the way, Bill. It might not be out yet, but Joe Belil and Carol Steinberg and some others, Michael at your shop, and reached out. And
I referred them to Leo. It's great hearing new people. Someone says, does anyone know this Leo guy? And then, I produced a 38-page dossier. I just saw a chat item from Lucy Chansky about access in bike lanes. I just was on a meeting between 10 and 11 with bike advocates trying to coalesce around the need to get a disability perspective into the expansion of bike lanes, which they really welcomed. And, in the world of being small, sometimes one of the premier bike advocates in this region, in this state, a man named Galen Mook, and he gets on and he says, my father worked on the ADA. And I'm thinking, well, it sounds like, my brother-in-law has a disability. I know everything. I take it a little bit. I've heard that before. So I Googled during the meeting. Sure enough, there's this major interview. His father was in the deep development and the legal underpinnings of the ADA. I haven't read the whole article, but he was a key staff attorney. There was no minimizing his role. So I seized that opportunity to build bridges on that, on the point Lucy just put into the chat. And that was just starting at 10 o'clock today.
I didn't even consider that. Until Lucy, is that a problem you've been hearing about, Bill? For you to be involved in it, obviously you've been hearing about it.
Bike lanes are like anything. If they cut right through and run in front of a sidewalk, in front of a curb cut, it's going to, some people, a lot of bike users are great, but some go too fast. If someone's getting off the curb who doesn't have quick reflexes, may have a sensory disability, whatever, can be real dangerous. Our office is at Downtown Crossing in Boston. I see lots of near collisions all the time. So it's going to take a lot of work to infuse a bicycle culture into a pedestrian culture, just as we've been, spending decades trying to infuse disability life into the broader community.
Now,
you know,
how about parking? How about the parking issue? And of course, Lucy's looking at it from point of view of handicap parking.
your disability parking, when you put in bus lanes, which I think are great, and bike lanes, which I think are great, you lose parking spots and you'll lose a percentage of disability spots. And that's a real concern. I know the Boston Commission on Persons with Disabilities consults with the city every time they put in a new bike or bus lane. And you need bus lanes to encourage public transportation. You need bike lanes to make it safer. So it really, you know, I think BCIL actually is a leader in some of this, was long overdue getting into the conversation. And they reached out to us today, and we're now in the conversation and added to the list of many issues. But it really is an important one. And I think it strikes the broader community. It's important for people in the IDD world. These issues are not separated by any means, especially in urban areas where there is a great amount of pedestrian movement.
You know, this is, again, a good example where you've jumped in, and it's something that affects us as well, and sort of owning the issue. And obviously, if you think more breath is needed or more groups, you'll reach out. But it's a great, you've squeezed it in somehow, right?
Yeah, you know, and I'll think of access broadly. I won't mention where, because there could be some identifying criteria. But there's a strong advocate in the IDD world. You know the person, Lee, I'm not going to give you any more. But their child is in a community residence. Great. Child who's an adult now loves it. Parents think it's a great place. Total integration, right? No. What's the problem? The house is accessible, but it's on a hill.
Oh, yeah. Yes.
And I've mentioned that to you.
Yeah.
And the residents cannot go, while they can move around the house because it's accessible, while they can get in and out of it because it's accessible, they can't go anywhere unescorted because it's on a hill, and it's a dangerous departure into the rest of, you know, down towards the street or whatnot. So that's why, you know, thinking of accessibility broadly in a kind of macro sense is really important. I know we have a limited, you know, housing so scarce that you know, DDS is going to scoop up a rehabable house if it's available at cost, pretty much. But, you know, you can have all the internal access you want. If you can't get out without escort, you have a very serious compromise on independence on people who may otherwise have been able to go out, or may be able to go out with limited assistance, and now maybe they can't. And that's
somebody wasn't thinking on that one. You know what I mean? Somebody was like, maybe that would have been a good house for folks that don't have issues, you know, having a wheelchair or have mobility issues. But clearly, right, somebody wasn't. And even going back up the hill. So it's dangerous going down, but then going, you better have some weightlifting exercise to get up the damn hill too, right? So what a great example.
You've got to do that if you're in a manual wheelchair. There's traction, there's all these kinds of things.
Yeah. So people, now that's like, to me, like almost an unconscionable mistake, right? Because, you know, how much was spent on the sighting, and nobody thought of that detail, you know, so.
Or they thought of it and decided it wasn't critical enough, which would be a problem, because
which would be worse. Yeah.
Personal mobility is pretty critical for anybody.
Right. So now on the medical side, you know, you did a settlement, right, was ICI? No, ICI wasn't involved. DLC maybe, or Greater Boston Legal with the hospitals, a few of the hospitals, correct?
We worked with Greater Boston Legal Services to get ADA compliance with Mass General, Brigham and Women's, then partners, now MGB more broadly, and with Boston Medical Center. They were legally binding agreements that they would get their facilities to comply with the ADA. They've expired. They had a time limit, unlike the settlement we have with the MBTA lawsuit. The facilities have invested millions in architectural improvements. The real key, though, along with that, and I think I mentioned it the last time, was they would begin to address programmatic access. And programmatic access means access to anybody with a disability. And I think I told the story of how we had, got some real positive improvements at MGH, but programmatic access for people with a communication issue. And that's what we really emphasize the most. If you get the basic element, you can get in the building, communication, because communication access may mean speaking slower, using people first language, getting American Sign Language interpreters, getting it on some documents on disc or in large print for people who can't see. How do you handle all these things where a patient, and I don't like the term patient, no offense to the medical world, but it puts a power situation on it. But how does somebody in a medical facility sign something if they have limited hand use? And of course, this presumes they're not ill or something like that.
Right.
But communication, listening to what somebody's needs are, is really critical. We did a great video series with BMC. And they asked, what are you going to focus on? We said communication. And we had one of our members who was nonverbal is featured and used an assistive speech device. Another is verbal, though she's not easy to hear because she uses portable oxygen. And another was a person with a significant intellectual disability, and how people would just try to talk over him. It's a real powerful, I'll send it to you, Leo, maybe you can share it, but it spoke to the varieties of communication needs in medical settings. And all three facilities, to their credit, have continued to work on this, though it's really essential we keep reminding people because they're barraged with issues. And if we're not the squeaky wheels, which I think many of us understand intuitively at this point, things slide, not because they want them to slide, but somebody's just squeaking, squawking, or yelling a lot louder than we are. So we've always got to have, whether we're diplomatic or not, and it's better to be that way and to work things out collaboratively, but we have to be loud regardless. And when it isn't working, we have to be a little bit more, which we've all been at times, whether it's through lawsuits, protests, rallies, complaints, whatever. It's not the first choice, but it's got to be in the arsenal. It's got to be used at times too.
People have to have some level of fear, because our power ingredient isn't so high as other groups. I mean, one of the things folks listening, think about the work it takes just to stay up with this stuff. So you got how many hospitals, right? It's not like you work with one or two hospitals. We have Operation House Call, and we know, that's not solving the world. You just gave some great examples of programs. I'd love to see it, by the way, the program you just talked about.
I'll send it to you. And I think I've mentioned this. We've worked on and off a bit with Mara Sullivan from your staff, who does tremendous work in the hospitals around people with autism. And there's still over 70 major hospitals in the state of Massachusetts. And then how many dentist offices are there? How many hundreds or thousands? How many walk-in clinics, community health centers, ambulatory surgery centers, whatnot, rehab facilities? The issue is huge. And if we don't nail it right on the healthcare, you really have disparate care, a huge inequity. We're working currently with Mass Health, along with Greater Boston Legal Services, as well as the Disability Law Center, to try to get them to have all the facilities comply with the ADA. It's been stalled a little bit during the pandemic, but there are a whole set of standards where saying they have to put out towards all medical providers. They did include in the last waiver a fund of about $9-10 million for smaller facilities to apply to get the funds, and that was successful to improve ADA compliance. So that wouldn't be for the big hospitals, but it would be where a barrier was identified by smaller facilities. But obviously the issue is huge, and we're trying to, forever promote this programmatic access, which covers the broader spectrum of people with disabilities, including elders.
Right.
Get older, you have higher utilization typically of healthcare facilities, and it may not be identified as a disability access issue, but we know they're just out there all over the place. Elders who may not be able to get onto an exam table, may not hear as well, where the communication comes in, may have some dementia where comprehension, cognition is lessened. So there's just this huge interweaving element. And, getting back to Bob Dole, supports the ADA, UN Convention on the Rights of People with Disabilities. These are, bottom line, always civil rights and human rights issues.
Yes.
Nothing less. It's a real important way to think of them.
Yeah, you know what strikes me, honestly, like here it is, I'm listening, and I think you can't help but learn when you listen. And what strikes me is we can't do this alone. You can't do this alone, right? If you think about the number, so do we build, maybe there is a cadre, a role for volunteers that, we need a more organized system working together where we get people to own their community in a different way. And to think about the different aspects of their community. There's healthcare, there's education. Think about how many people lose out on education. We haven't even touched on that. But this is then why people want a segregated doctor, or they want a setting where, okay, now I can go, I don't mind driving 30 miles to Dr. So-and-so or the dentist, because now I know, we have that problem in our field, right? With the Tufts, there's nothing wrong with Tufts dental program. I'm not knocking, they're great, but it does force people to go for those choices, or maybe it doesn't force them, but they feel like that's the easier way. It's not the easier way, really, in the long run, right?
Yeah, healthcare and specialists is a real daunting issue. I know many people with IDD keep their pediatrician way into adulthood, but it happens with physical disability too, because you have unique health conditions. That's where the education of the medical profession, trying to get people to move into more diverse fields. You hear about a need for more gerontologists. You need more specialists, I think, who can work with folks so that everything, say, around here doesn't have to necessarily pivot through Children's Hospital, as wonderful as it may be,
Yes.
And I think, there are some, broader steps. One of the great initiatives in the last decades has been healthy aging communities that a lot of aging communities in this state, internationally across the country, have embraced, looking at what it means to have an accessible aging community. And it's thought about people aging in place, aging and going throughout their community, their city, town, going to facilities. I look at it, and a lot of us in IL would chuckle. They're using the language we started using in the 70s and the 80s, have appropriated it, and it's as if they came up with it on their own. And that's just a wonderful thing. It's a wonderful thing. Nobody owns the right to human dignity or freedom or independence or access, integration, all those words that mean a ton to all of us. The elder community has adopted it, and that's a real good thing. In the bike meeting, somebody said, and they were very right, when you improve access, it improves it for everybody, because everybody can use a curb cut, use an elevator, things we know. And I said, there's one other factor. When the full community is integrated, everyone benefits. No one benefits from segregation.
Right. Great point. Lori just wrote something about the bike stuff. Supposedly the Metropolitan Area Planning Council is supposed to help towns and cities address issues that Lucy mentioned. So have you had that experience?
Yeah, MAPC is great. I should know them well, because their home office is 60 Temple Place at Downtown Crossing. BCIL's is 60 Temple Place, Downtown Crossing. We're on the 5th floor. They're on the 6th and 4th floor. So we were talking a lot with them pre-pandemic. I was involved with the committee and it slid when the pandemic hit hard because we just, so that's on me, my delinquency for not following through, though. It's not like we just, started.
Right. I think you're off the hook.
Put our
Yeah.
feet up. No, we went into PPE
Right.
distribution, vaccine advocacy, and everything, and worked with you.
Yep.
Crisis standards of care, just trying to keep our folks alive was
Right.
goal number one.
Exactly. Yeah. And the crisis standards for care were key. We're just finishing up an emergency rooms national project that should roll out. I guess this week, Maura is doing a presentation for the ArcUS, but it's an on-demand video as well as smaller videos for emergency room doctors. So it looks like, I thought it would be unnecessary, but it's obviously necessary long-term with the pandemic, let alone, people go to emergency rooms for all kinds of reasons, right? But I was wondering if people want to ask you some questions or comment on some of the topics, that we were just talking. I was thinking about, by the way, when we did that healthcare study in 97? And we ended up doing stuff together on the focus group.
Because I was already at BCIL, I think, but I don't know. We've done so much together.
Oh, 2008. You're right. 2008. Okay, I can't believe it. I can't get the years right anymore.
Yeah, I am welcome for comments, questions, critiques, or how come you didn't follow through on this? I get that a lot.
Yeah. Well, I'm hoping people today are getting the message about how broad, your range is. So Lucy brought up, had a serious issue of discrimination at the private partners urgent care. The receptionist said, "We do not serve people like him." It went downhill from there. And then other urgent care, urgent care services need educating. Have you heard anything about people's experiences? Wow.
I haven't heard that. I would send I'm happy to direct and connect with my contacts still in the system. They're not quite as strong as they were when the settlement was in. All the hospital presidents have moved on or retired, but we still have contacts. That should go right to the top of the MGB. Yeah. That's utterly unacceptable if that happens. That
what I'm thinking? That could be like a workforce issue too. It's a great example where they have so many damn settings now, right? All of these medical centers, and just staffing them must be something. And I know we've been to some during COVID. We had to go to one, and we found the customer service not great in general, let alone what Lucy's describing.
Our partners has, I think, MGB, Mass General Brigham, has over 80,000 employees right now. They are the largest employer in the state of Massachusetts.
Wow.
They are a significant player in what goes down in this state in healthcare, employment policy, things like that.
Wow, I didn't realize it was that. I knew they were big, but that's overwhelming. Early on in the conversation, Lucy put out that Massachusetts is no longer paying for Part B Medicare. And I guess she's talking about the what's it called when they do the premium supplement, right? And I guess we could ask Linda at DLC or folks at Greater Boston who also, get involved in this. So Lucy, we can ask about that. Premium assistance, we assume maybe the person's income hit a certain number, but duly eligible. Should Medicaid pay premium? Historically, yeah, but she's asking because it's $1,576 a month is what the person's income is, and maybe they tipped over, the right number for one person.
Yep. Yeah, I'm not aware, but if you can save the chat, we can follow up with attorneys, and I can, we can try to get a response to that. I do see Diane has her hand up.
Diane, go ahead.
Oh, okay. I chatted this to Bill. Probably didn't see it, but I think years ago, Bill, I met you at the, or folks from your shop at the Cross Disability Advocacy Group. It used to meet at One Beacon, and
I remember.
It was funded by DLC, and then it got defunded. And I think it was just a phenomenal intersection of all these these different organizations that have needs that meld together. I just wonder if you think anything like that is worth starting up again, or it just sounds like you're already doing it.
I have some pretty strong opinions, and Leo and I haven't always agreed on this. And I'll tell you why, so I can take a jab at Leo here, right here. Hold him accountable. I think I think the idea is we all should keep talking, and I think a forum like that where people keep talking, sharing notes is fundamental. No argument. I'll tease Leo. I think he always drifts off into trying to think of the big organization where we're all together, and I think each organization's separate agenda ultimately terminates the effort. But so that's the only disagreement. We agree totally on the value and need. I mean,
no, but are you saying that I'm for a big overarching?
Yeah, we had that discussion once, and I think you wanted.
But that's a long time ago.
Yeah,
I actually, so because we have, like, if you remember, right? We weren't invited to the Disability Policy Consortium development. Remember that? And you might not even know that. You might not even know that. So, or they thought we didn't need it, or we didn't care.
Yeah, which is kind of funny because it might not have happened if I hadn't run into Mary Lou at the
Right.
Maloney at the State House one day, got some money for the DPC, but that's
right.
small
Isn't that a riot?
irony there. But anyway,
But I actually know.
may be our strongest ally at BCIL, by the way. So we all moved past anything like that 30 years ago. I do think Diane's right. Periodic convenings would be good, not just when there's a crisis and we come together, maybe.
Yeah. You know why we don't do it, though? How many meetings are called, damn it, in government alone that ask for stakeholders, right? Sorry to use the word damn it, but it drives me crazy, right? And between, now Maura attends the groups you facilitate with Mass Health, right?
Yeah.
And then there's other groups. I go to the district meetings, okay? Dennis Hafey shows up there and others. I mean, it's really, that's just two of, like, I don't know, 30 examples. So I think that sort of crowded us out. So I'm all for it. If you want to, we get together and schedule something, maybe we just do it once a year at first, just get together once, see how it goes. And then maybe we want to do it twice a year if we can pull it off. But I agree, because then we could go and then figure out what are the issues. I think in a way, Joe Belil did it around these ADA issues, right? For buildings, both residential and business.
Joe works with Easter seals for people.
Right. Let's let people know that. But he brought us into that and said, look, why aren't you part of our group? So he did it offline, right? Without a group meeting. But I do agree that, that.
Well, I think it's real important. Diane, you raise a point that's got me thinking deeply here. A real challenge for disability rights will be bringing new people along. I'm not young, Leo's not young anymore. No kidding aside. And at some point, we'll move on. We've seen a lot of movement of people who have been around for 3 decades or longer in healthcare advocacy, disability advocacy, elder advocacy. We need to facilitate these connections for younger folks because they may not happen as naturally now, especially during a pandemic. There's such a use of technology. We're not moving away from that at all, but so much was done in the cauldron of traveling in a car together to a meeting, having coffee before a meeting. We'll resume that, but I do think we have to actively link, a next generation. Everyone always says that, but I do think it's a little bit more serious in disability rights because a lot of folks have been in a leadership role for many, many years. Paul Spooner of the Metro West Center.
Well, you think about the people that already retired, though. Jim Krudnier, Charlie Carr, he's still active, but close colleagues of ours, right? There's a few others I can't even remember. There's people that passed away, right? But you have Paul Spooner who's going to be retiring. I'm going to be retiring probably before you. But I think in our world there's a bit of more. We know who's there in our worlds, right? So the question is, how do we mentor them? together for that even second follow-up generation.
Yeah, and it's not just leaders talking, it's grassroots folks like we have on this call today. I think if we, for a minute, think, oh, it's just Bill, Leo, and five clones of us talking,
No.
then the movement's in real trouble. And I say that sincerely, not kiddingly. It really is incumbent upon a steady flow, you know.
No, I want to reinforce that, Bill. I'm so glad you just said that. It isn't just about that, because Nikki's Law, I was telling this to some of the families. We were having a drink after the signing, and I said to them, you have to have long-term advocacy organization, whether it's BCIL or the ARC or MAMH, regardless. But what keeps us present and current is the volunteers and the pressure from the grassroots of what's happening. And the registry for us was an example of that. I think all the stuff you've talked about today, healthcare, transportation, access, all of that keeps us more honest, but we have so much more to do. And during this crisis, you know, losing the volunteers, not having new volunteers, that's why I'm wondering is there another strategy we need to invoke around people in the front lines that we're not doing enough? And then how do you do it and stay in touch with the resources you have, right? Because we don't have unlimited resources.
Good questions. Just to emphasize how important it is, I can't tell you how many times I've been in a meeting and Ian Frack, who I'm looking at on the screen, brought some discipline to the meeting on in a very appropriate way. You know, most recently with our interactions around the whole issue out at Fernald and the light show, and now the you know, she insisted that self-advocates take the leadership role, along with a couple of other folks, on the whole effort to the legislation around remembering what went down in the institutions, the history bill that Alex Green's helping organize.
Right.
And that just has this real powerful grassroots voice that's so critical.
I guess the city, by the way, the city's having a meeting Wednesday night. I didn't know that till just a little while ago, to discuss recreational uses of the grounds. So I don't know who's planning to go there or not go there. Someone I know is planning to go there and is going to talk to me before Wednesday. But that's a great example. That's another example. Making sure people with disabilities are front and center. I want to do two things. Talking about Ann, she and Hezzy Smith are organizing something. It's a focus group for people in group residences who lived through the pandemic, right? And so you guys are going to have a focus group. I don't know how to put a PDF. Can I attach a PDF in here so people can have the information? But we can send it. You know what? Yes, I'm at the City of Waltham, Lori. That's where the meeting's going to be Wednesday night. The mayor's having an input, according to, again, a volunteer who's active and, you know, just told me about it. So that's number one, and we'll share it with the PDF about that, because they're looking for adults over 18, not family members, adults over 18 living in the residence. But the second thing I want to do before we end the call, go ahead, Ann, and then I want to ask Bill one last thing.
People that are their own guardians that are living in residences.
Okay, I'm going to share whatever your form says. I'm going to send that out. Okay.
Okay.
So, and then Bill, we heard big news last Wednesday. I did a blog on it on Thursday. About Governor Baker not running again. And, you know, what do you think in a few minutes? Do you want to say your reaction? Because
I was going to ask you who you predict to win. It's a wide open race between Maura Healey and Maura Healey, it seems to me. But that's my early prognostication, of which my track record of wrong ones is too long to list here.
And if she won, she'd be the first. We were just doing the number count on 4 attorney generals who lost elections for governor in the past 20 years. Frank Bellotti, Tom Riley, Martha Coakley, and Scott Harshbarger, who we liked, a lot, right? So
Scotty was and is a friend. Yeah, we'll see. And I will go on record that the only woman governor we've had in the state, Jane Swift, is the only governor BCIL has not or Cord when I was there has not had to put people in the office because of a planned destruction of the PCA program, which they always then pull off the table. Swift was the only one who had the wisdom not to do something
So,
with the PCA program in
yeah.
a negative way. I have
It's a
seen Mary
shame.
Mahone McCauley's hand up for a while.
Go
head of
ahead, go ahead,
MOD.
Mary. Sorry, I apologize for not paying attention. My bad. Go ahead, Mary. Mary? You got to unmute.
Maybe she stepped away.
Oh, okay.
Mary's
She probably
the
got-
director of the Mass Office on Disability and a disability advocate for sure in her own right,
Right.
besides having that important role. And Leo,
Uh,
who do you see for governor or anybody else?
I'm not surprised that he's not running again, but I was hoping he would. I know it sounds absurd that I would want a third term governor, but I really think, we have to fight hard for things regardless of who the governor is, right? But I do feel like we had a situation where there's been positive relations. So I do hope, Maura Healy has been responsive and listened to folks. I don't know. Ben Downing, well, on the Republican side, I mean, if Jeff Deal's the only one, I'm not, nothing against Jeff Deal. This is not a partisan statement. In terms of his track record on disability, I don't think there's much there. I would have to research. He might have co-sponsored a few bills, Bill. I don't know. Do you remember?
I don't know. I met with him on an issue about 5 years ago. He was an extremely gracious individual. I know that. I'm not sure I agree with his overall politics personally, but we're nonpartisan too.
Right.
It's a democratic process, and what the real message is for us as advocates, all of us, is we've got to get involved, and maybe that's where we do some collaboration. Leo,
let's get an interview. Let's interview the candidates and see if they'll sit down early and talk about
I
disability.
think that's what we do. Maybe that's where you bring it together and have somebody from every community. So it's not just looking at this issue or that issue. And because who gets elected is important. Who they appoint is more important.
Yes.
Because day to day, they won't be dealing with our issues in their mindset, but they'll appoint a Secretary of Health and Human Services, Secretary of Elder Affairs. They'll appoint their commissioners of DDS, Mass Rehab. Those are the key positions in our life. And who's making those important appointments is really critical. So maybe that's it. When Baker ran, we got together at the old Perkins School. It's not old, it's on the cutting edge, really, Perkins School out in Watertown, and had a forum with the candidates. I remember it well, and maybe that's what we need to be thinking of already. Whether it's Ben Downing or Sonia Chang Diaz, Jeff Deal, Maura Healy throws her hat in, whomever.
Sonia Chang Diaz. I keep
Allen, the Harvard professor, all of them.
Yeah, I don't really have a handle on. I'm glad you added the names because I don't want to appear, favoring any one person. So I appreciate that. Mary, if you're back at your desk, Mary McCauley, you're welcome to say a few words, and we'll give you like 10 seconds, and then we're going to call it a day. Okay, so we're going to have next week, Bill. Thank you so much. This was great. Let's get working on planning a session. We'll invite, I guess, DPC and other groups if they want to be part of that. And then we'll follow up together. And I just want to say next Monday, I'm going to have a few parents and we are going to do a session. We're going to recruit some self-advocates as well down the road, talk about the pandemic on the show, but we have a sibling and two parents to talk about some of the barriers they experienced during the pandemic. And so I'd love to have Ann, maybe you could help me round up some people that aren't just living independently, but a couple of people in group residences as well. We did that some months ago, and it went pretty well around day services and getting back and what people wanted to do. And I'd love to do that again as well. There's been some tension, I guess, with family members and group residents, group homes and congregate settings, a lot of tension with the workforce crisis. So that's going to be the topic next week. And then we're hoping to have a DDS lead staff talk with individuals and families who aren't getting any services because they need more assistance. and one-on-ones. So they're actually losing out more than other people in terms of the day supports. So hopefully we'll do that soon as well. But next week, it'll be focused more on residents and building better communication and some of the issues people have faced. So Bill, thanks again. Really,
My pleasure.
this was good. And look forward to seeing you soon down the road in
All right,
person.
thanks for having me. I love all the work everybody does. Wonderful, wonderful, wonderful. I don't say that patronizingly. I say it with admiration, being in the same field.
Take care, everybody. Have a
Bye-bye.
great week.
Thank you.
See you, Leo.